A 55-year-old female patient shows up in our office and says, I hear you do dental implants. I'd like to have all my teeth extracted. I want to look good for once in my life. Is that the right decision? That's what we'll talk about today in practical treatment planning. The patient had lost a fixed bridge, replacing number 7 through 9 about 2 years ago. She's been wearing this Essex appliance ever since. You can see the gumminess of her smile. How'd the patient lose her anterior teeth? Well, it could be lack of posterior support. Certainly, this incisal overlap that had to be present has to do with that. But can we create a prosthesis utilizing the existing gum and bone? And when we look at the PAs, we take a look at the position of the sinus. Look at where the sinus is, and we'll look at the CT scan as well. It's difficult for us to place implants beyond tooth number 5, isn't it? Look at the prominence of the sinus on the right side. The sinus on the left side is fine. There's plenty of room there, but very little room without doing sinus lifts to do work on the right side. Take a look at the occlusal contacts. She has occlusal contacts on teeth numbers 2, 5, 6, 12, and 16. That's not bad. There is posterior support. Could we gain that kind of posterior support from dental implants without a lot of reconstructive procedures? What's the best way of establishing occlusal contact? I've worked with computer-generated programs, and I won't give the brand name, but I've used that. I'm going to tell you, shim stock works very well. Let's take a look at how shim stock is used. Shim stock is a very thin piece of cellophane, and all we do is place it between the occlusal surfaces, ask the patient to bite down hard, and I try to pull out the shim stock. If I can't pull out the shim stock, I know it's in contact. If I can pull out the shim stock, I know it's not in contact. Very easy way of establishing distribution of occlusal forces and know what's in contact and what is not. Let's take a look at the periodontal chart, and you'll notice there are some pockets on the upper left side. They're not too terribly bad, and certainly with the tooth arrangement and the root proximity problem that you see right here, that pocket is probably going to be there anyway. It's probably a pseudo pocket, and so we will work with it. Certainly we're going to clean the root surfaces off, but this is not severe periodontal disease. This is something that we can work with. Now, she's on a budget. She can only do a little bit at a time. Could we extract all the teeth, put in implants, and do full arch prosthesis? Sure, with an awful lot of alveolectomy, and still we have the sinus problem on the right side. How do we deal with that? How do we give her posterior function on the right side with dental implants that will match what she has on teeth numbers 2 with 31? We can't. Now take a look at the position of tooth number 10, and you'll see tooth number 10 actually is not in an aesthetic position. Tooth number 10 is contiguous to the ridge on numbers 7, 8, and 9. Do you want to keep number 10? We may. What do we do with tooth number 10? We do a procedure called crown lengthening. We remove enough gum and bone that the cervical margin is in the correct position. And then we scallop the gingiva and the bone in number 7, 8, and 9 in order to get rid of the gumminess of the smile and give her something that will look good. Implants in the number 7 and 9 area will complete the process. She can have an implant-supported fixed bridge, number 7 through 9, with a new crown on tooth number 10. What would we do later on? I would give her a night guard. And the night guard would be a night guard that we make where we can direct where the occlusal forces are going. You know, most people talk about a full arch night guard. That may be a good idea here, but I'm not sure that I want stress in the anterior region. I might ask for stress only in the posterior teeth on the right and left side. They're stable, and take the stress off the anterior teeth, particularly at night or when she's not thinking about it. So the stress of the bite is being taken up by the posterior teeth, not the anterior teeth. Now, in conjunction with placement of the fixed bridge number 7 through 9 and the new crown number 10, we would do an incisal adjustment on number 23, 24, 25, 26 in order to be able to create room and reduce the amount of the incisal overlap. That will help to ensure the success from a force distribution standpoint and from an incisal overlap standpoint and from an incisal guidance standpoint. Let's take a look at the implant positioning and note that we're using narrow implants. In the number 7 area, we always use a 3.0 implant, never any wider than that. But we also want to look at bone considerations. We always want 2 millimeters of bone around the entire circumference of the implant. Here, we may have to build out some bone to provide that, particularly in the number 9 area. In the number 9 area, we'll also use a 3.0 implant. Why? More bone. We want more bone and less implant. More bone attached to implant allows for more blood supply to that implant. So we're going to use a 3.0 implant in the number 9 area. We'll build out the bone tissue and the soft tissue in order to be able to create a correct emergence profile on number 7 through 9. The idea is that we want the abutments and the teeth themselves, as well as the pontic, to emerge from the tissue and not overlap the tissue. What else do we want? We want the best distribution of occlusal forces. Now, we'll use the night guard temporarily in order to be able to accomplish that, and frankly, we'll probably use the night guard forever. But we do want to fill in the posterior teeth in order to be able to provide correct occlusal contacts. Would I like the tooth distribution to be orthodontically corrected? Absolutely I would. That would be my first choice. Take out all the prostheses, line up the teeth correctly, and then we can create upper lower prostheses that are tooth supported, and she'd do just fine. But that's not what you can do, and that's not what she can afford. And so we take this a step at a time, providing her with what she wants, good anterior aesthetics, and then move towards providing functional distribution of the load in the posterior, using the night guard as a temporary method of gaining that. Later on, we'll provide posterior support in the right, posterior support in the left, and then the prosthesis will be complete. Please like and subscribe. Thanks for joining us. We'll see you again next week.